Hi, I'm Dr. Britton,
I'm Aida.
And I'm Michelle.
and we are West LA Neurokinesiology. Today we're here to talk to you about insurance and insurance coverage, because we do accept insurance, but insurance has a lot of little different things that people want to know about, and so many of my patients that ask questions about it, I want to get down to the real, so that way you understand what's going on and what's BS. Alrighty? So we're going to start off, and Aida and Michelle are going to just kind of ask questions that you might ask when you come in, so that way you can have some of them answered ahead of time, okay? Alright, so who wants to ask the first question?
Me.
Okay.
So do you take insurance in your office?
Yes, we do take insurance. We take PPO insurance, we take Medicare. Medicare, all providers have to accept some form or the other. Sometimes people prefer to send the Medicare bills in themselves. That's fine, because we'll give you all the codes you need to be in all the different treatments that we do that Medicare accepts. For people with a chiropractic license, Medicare only covers chiropractic. Okay? And yeah, does that answer sort of that question? So we do take them, and obviously there's a lot of small intricacies for that.
But then, do they look at like what condition you have? Like, is it neck pain or back pain?
Great question. Will you hand me Bob, please?
Sure.
So this is Bob. He's our mascot. He's giving his life to being able to help educate people on certain conditions. Okay? So Aida's question, does it cover neck pain and back pain? Well, in a way they all do, and I say, unfortunately, if you're in a physician's office who's calling you, telling you have neck pain, back pain, or arthritis, they're giving you kind of a dumb answer. Why? Because neck pain is not the cause. Arthritis is rarely the cause. Something caused the arthritis. Something caused the neck pain. You can have neck pain because the little facets, the little hinges here, are getting impinged, and that's causing you pain. You can have it because the nerve's getting pinched. You can have it from old-fashioned chiropractic misalignments. You can have neck pain because what's going on is signals that are supposed to come to the brain when you're moving around aren't getting there. Your neck's tightening up and squeezing on nerves in the musculature. So each of those things changes why the neck pain. So insurance loves to cover boring, dumb analysis of neck pain. They call it cervicalgia, and they'll give you like $20 a visit for it, and they want it to be done in 3 visits. For those of you who've got a little more common sense and have had this problem for a year, 8 months, it affects your ability to work, play, have fun, be intimate, that's probably not going to get down to the cause of it, or you wouldn't be watching this video. Your pain would be fixed already. When it's facet problems, your doctor needs to be able to diagnose that and tell you about it, right? And facet difficulties last a lot longer than muscle problems. If it's encroachment of the nerve, they call it foraminal compression, sometimes stenosis. Your doctor needs to be able to tell you about that and tell you your options for fixing it. We have several options for fixing it, and it really depends on your x-rays. Now, to the insurance companies, they won't care. You're all widgets in a system, and they're going to say, well, great, facet arthropathy, get an injection. For those of you that's what you want to do, you shouldn't be watching this video. I'm not your choice. When we look at what my training is in, which is functional neurology, kinesiology, chiropractic, and laser treatment, then we're looking at something much more specific, and that's on other videos. So we're looking at neck pain or back pain, we've got to identify what the pain's coming from. Some insurance covers like 12 visits, some will cover 24, and at this point in time, very few will cover more than 12, just to be honest. Okay? Medicare does not care what the cause is. The military insurance, which doesn't cover here anyway, doesn't care what the cause is when they're looking at a license of physical rehabilitation. Until you're willing to get injection, surgery, they're going to put you into PT, or they're going to put you into injections, and that's it. Okay? For us, we want to identify it, because I don't want you coming back for your money back, and I don't want to see you 3 months later pissed at me because you didn't get things done. I want to be able to tell you what's going on and how we're going to fix it. So that's why I stay out of network. I give you my treatment. If mine doesn't work, you can get mad at me. Okay? All right.
Next. So my next question is, if you have a herniated disc and we need to use the decompression table, does insurance cover that?
So the quick answer is no. Insurance will cover chiropractic adjustments. It will cover physical therapy, the rehab for people who've back pain, but it's not specific that it's back pain for herniated discs. Their solution for that is a combination of injections and or surgery. Again, see the last 5 minutes ago where I said, that I'm the wrong doctor for you. The question Michelle asks is about, what about decompression? Insurance companies have explicitly said we will not cover spinal decompression. There's a bunch of political BS about why decompression works, how it helps, and there's a lot of practitioners who are not doing specific decompression. They put you on the same table, the same position that the other 52 patient came in before. Our table lets us specify the position, the rotational angle, and the lateral angle, meaning side to side, up, down, or a turn, to be able to actually address your problem. So, since they've explicitly at Medicare and who's the insurance, the people for the military? Whatever, VA, military insurance have explicitly said we're not covering that. All the rest of the insurance companies stack on top of that and they go, yeah, we're not covering it either. Even though it's been shown to work, it's shown to be effective and a painless way to fix it. Because decompression care uses a very expensive table that senses the muscle compression and senses the tension in your body, so it's stretching you slowly to open up the disc space. So no, unfortunately, decompression is not covered. And most discs aren't going to get fixed from just a crack of adjustment. And to me, doing physical therapy, meaning moving around doing core body work, when one of the tires or the discs are exploded or damaged, is actually damaging it more. If you heal while doing that, you probably have the genetics or the youth to have healed anyway, right? Just use a YouTube video. Again, I think of myself as Coke and some of the other producers, some of the other providers as Pepsi. I am not here to make you why they work, because there's millions of people on this planet. Hopefully there's lots of different treatments. I'm here for the people for whom want to get better, want to be able to see radiological evidence of improvement and be able to get back to their lives. I'm not trying to get you good enough to sit on a couch. I'm trying to get you good enough to get back to the life you were working your butt off to live. All right. Anything else?
How about kinesiology, since that's what we focus on in the office?
Okay. So she'd asked a very, very informed question. One of the things about kinesiology that people have a trouble understanding is kinesiology is the study of body movement, how your skeletal system, your bones, your fascia, that's what holds your bones and ligaments and everything in one place where they're supposed to be, and make sure the blood vessels and the nerves are held in their place so everybody gets what they need, right? Kinesiology combines muscle memory, normal unconscious or subconscious ability to balance and deal with gravity. You don't get out of your car and go, I hope I still stand. You get used to getting out of your car a certain way, right? Has anybody ever had an injury where they can't move or can't lift their arm and they always forget and they hurt themselves, right? So kinesiology talks about how do you reprogram the brain to deal with the injury in a way that's not compensational to make the injury last, but to help the body rehab itself. Remember how to grow and deal with the environmental problems. Anytime a kinesiological problem lasts for around 30 to 60 days, what you start having is a neurological problem, meaning your brain says this is normal now. If that normal movement is bad for the spine, bad for the nerves, or abnormal loading on muscle, now you've got a whole realm of problems that starts even changing your hormones, starts changing how you feel and how you move in gravity. So those are much more complex, and that's what we like to deal with. If you're able to go to a massage therapist and everything feels all better, you don't need me. You don't. But if you've noticed you've tried everything, and what we have now is a compensation that's lasted for a long period of time, combining kinesiology, chiropractic, and decompression, those layered efforts are what help people get better when they hadn't seen results before. So it will cover parts of the manual therapy that's part of our kinesiology program. It won't cover, let's say, direct current stimulation, and it doesn't cover for me when I'm treating without an MD, right? It won't cover some of the tissue maintenance that we need to do. They want to call it massage. If they come see it, they know it's not massage, so I'm not going to have my license jerked away for trying to build insurance companies for something they explicitly say we're not covering. So you're stuck in this position that you've got a unicorn and you're supposed to try to figure out how to address it and sell it as a horse. And if you do that, you're lying. If you don't do that, you don't get paid. I'm the unicorn, by the way. All right? So I hope that helps answer some of the questions about the treatment, okay? Insurance covers some things. If your diagnosis and the codes we send to your insurance say one thing, and your insurance is going to look at it and say, we'll cover this and this, but we don't cover that. And then I'm going to show them the treatment diagnosis for the treatment we're going to do. and they're going to cover parts of those treatments, and they're not going to cover other parts. And they seem to get this great carte blanche of taking your money for your insurance premiums, but then they go, no, we're going to pay 20% of that, 30% of that, and 40% of that. And that's how they break it up, guys. So for me, I have a business. I have to take care of a family. I've worked a long time. I've now spent over 15 years learning how to do what I do. And the great thing is I'm the one, and my staff, we're the ones accountable. So you at least don't get passed around. If you're not happy with what happens, we sit down in his office and we have a really not fun conversation until you're happy. All right? So this is going a little long, and it's one of the most boring topics in the world, called insurance coverage. I hope this helps you understand what you're walking into, but please do bring your insurances, because we'll at least give you super bills so you can go after especially your PPO, your HMO companies and things like that are saying they're not going to cover it. And maybe we'll get some change affected eventually. All right, well, that's the end of this one. Thanks for your attention.